Hello, everyone, and welcome to the Let's Talk series, episode 2, organized by Aesthetic Medicine India and powered by Galderma. I hope you all have had a great start to the new year and wishing you all a very happy new year and great successful times ahead. So one of our most recent introductions, the Let's Talk series, was launched last year. Although it was recent, but now that we stepped into 2022, it was launched last year with our first episode on personalization with Restylane Define with Dr. Narmada Matang, who's a dermatologist, neoskin aesthetics from Mumbai, and Dr. Divita Buraria, who was consultant dermatologist, Betani Hospital and Disha Skin and Laser Center, Thane. Being a very successful episode, today we are back with our second episode. For our Let's Talk series, we invite two aesthetic medicine practitioners to discuss an aesthetic treatment along with case studies. And our today's webinar will focus on lip fillers 101. I am Shriyal Setumadhavan, the executive editor of Aesthetic Medicine India. And on behalf of the aesthetic medicine team, I would like to thank our partner Galderma, our guests and speakers, and our viewers for joining us today. Aesthetic Medicine is the original business-to-business magazine for discerning aesthetic professionals. Founded in the UK 18 years ago, the India edition is founded and led by the Professional Beauty Group. I would say it's a must-read for medical practitioners such as dermatologists, clinic managers, cosmetic dentists, aesthetic doctors, medi-spas, plastic surgeons, selected aestheticians, and cosmetologists. The Aesthetic Medicine Expo and Conference was introduced in India in 2019 with the aim of connecting the medical fraternity with the supply chain stakeholders and providing a platform for networking, sourcing, and training. Then came 2020, and since the world was besieged with the pandemic, we at Aesthetic Medicine continued working hard to keep the fraternity engaged. We took on the challenge and set ourselves on an exciting digital journey. And in all success, the Aesthetic Medicine Digital Series were introduced, and our webinar and online interactions with experts have been instrumental in bringing vital information to practitioners on various aspects. You can follow us, Aesthetic Medicine India, on various platforms. Our website is aestheticmed.in. My team will key that into the chat box for you. And you can subscribe to our YouTube channel, follow us on Instagram, like us on Facebook. The easiest way to find us is Aesthetic Medicine India. So today's webinar will focus on lip fillers. And before I detail the topic and introduce you to our eminent speakers that we have with us today, here are two videos from our partner Galderma. May we have the videos, please? Like I mentioned, we have one more video to follow from our partner Galderma. May we have the video, please? So since these are consumer education videos, they could be available for you to play it at your clinics as well. So you could ask your medical representatives from Galderma to help you get access to the same. In today's Let's Talk series episode 2, we have Dr. Apratim Goel, the medical director and founder Cutis Skin Solution Mumbai, as our subject matter expert, and Dr. Akanksha Singh Kornut, founder ProMed Aesthetics Bangalore, as the moderator to talk about lip fillers. With the initial discussion focusing on trends, regional practice differences, cleft lips, complications, and much more, today's session will be followed by some interesting case studies that will be analyzed and discussed by both doctors. So ensure that you are with us till the end, because the beginning discussion as well as the case studies is something definitely to watch for. Introducing our speakers for today, Dr. Apratim Goel. With 20 years of experience, Dr. Apratim Goel is a trainer as well as a pioneer in various lasers, derma roller, botulinum toxin, and fillers in India. Her specialization includes dermatology with special interest in lasers, threads, medispa, and injectables. To be up to date on the new technologies for skincare, she has been attending extensive training courses on various lasers, thread lifts, mesotherapy, botulinum toxin, fillers, and other cosmetic procedures at various prestigious institutions globally. And she does offer a lot of trainings as well. Dr. Akanksha Singh, an MBBS, PGDCC, Master Injector, London. Dr. Akanksha graduated in medicine from the Raja Rajeshwari Medical College, Bangalore, following which she obtained a PG diploma in aesthetic medicine from the Indian Institute of Laser and Aesthetic Medicine. She subsequently worked at one of the most reputed aesthetic institutes in Bangalore. After completing an advanced Botox and filler training at Derma Medical London, she set up ProMed Aesthetics Clinic in Bangalore. She is member of the Association of Facial Aestheticians and Aesthetic Surgeons of India. I now request Dr. Akanksha to take this discussion forward with Dr. Apratim on today's topic of lip fillers. We have 60 minutes for the discussion. We would keep it 50 minutes between the two of you and leave some space for Q&A from our attendees. Having said that, for all my attendees, do not forget to share your questions with our doctors today. They're going to be very happy to respond to them. A very simple rule for your question to be answered is at the bottom of your screen, you will see a Q&A box. Please make sure you key in your questions into the Q&A box. My team and I will be talking to you through the chat box, but if you send your questions into the chat box, they may be missed. So request you all to please key your questions into the Q&A box. And if you want to talk to me, you have the chat box for that. So over to you, Dr. Akanksha from here, and we look forward to an engaging session. Over to both of you.
Thank you so much, Shreya, for the lovely introduction. And I'm so thrilled and excited to be a part of this discussion with none other than Dr. Apratim, who is a lip filler pro, has injected over 1,000 lip fillers over 20 decades. I love personally injecting lips, and I'm assuming you love injecting lips as well. So what is it that you enjoy the most? What is the most interesting thing about, injecting lips?
Hi everyone. Hi Akanksha, and thank you Aesthetic Medicine. I have loved my journey with you, which Shriyal you started at the right in the beginning of the lockdown, and thank you Galderma for giving me the chance to talk. I think we initially started off that we would discuss tear troughs for this meeting, and then I requested Galderma that look, something which wakes me up in the middle of the night would be a lip filler. It definitely won't be a tear trough and under eye. And they were kind enough that, okay, fair, we should do this. So I would love to share my experience. Now, Akanksha, you asked me that what is about lip that excites me. So lip filler, first of all, though it is put in the advanced indications, for me, lip filler, I think I have kind of started my journey of fillers with lip filler, so I don't find it advanced per se. One area which has rarely given me any complications, and a very little amount, so the cost to the patient is very less, and a very little amount, the satisfaction index is so high, it's right there. And then the other thing is that there's nothing else. There's nothing else. Even if somebody doesn't do a tear trough, you can do peels, you can do lasers. If you don't want to, do the cheeks, you can still do a HIFU or an Altera. But I wouldn't know what for lips, honestly. So
this is more impactful than any other
and it is something like you don't have a substitute. So if one wants that, then that's what you do.
True. And now we have all these new trends popping up on Instagram and TikTok, like whatnot, Russian lips, devil lips, also wavy, what is that, octopus lips. So how do you think lip fillers have evolved ever since you started practicing? Do you see a lot of change, or do you see like people are, kind of going crazy?
So I see a change in the product.
Yeah.
I also see a change in our injection techniques. And I also see a change in consumer, in our clients. What do they want? Right? And a lot of it is driven by social media, of course.
Yeah.
So talking of products, there was one Restylane way back when I started injecting. I remember in 2004 and 5, I injected just one filler for everything. We would put that here, there, lips, nasal label, everywhere.
Yeah.
So, initially when there were lots of fillers available, I was not of, because, I could take one syringe and put a bit everywhere. But then, understanding fillers, like Galderma has literally spoiled us today, right? They given us a lift for chin advancement. They have a define, they have a Volime, then they have Restylane Classic, which personally is my favorite. Then we have Kiss, then we have Vital. So I think with the choices available, we are more informed. We can give, more accurate desired results, and talking to patients become easy as well.
Yeah.
So, and then today, as I said, we are spoiled with the amount of fillers available to us. And most important, Akansha, probably you were not even a dermatologist when I started injecting. So you have no idea the pain which you go through when you have to give a block, intraorbital block and the vestibular block, to actually numb the lips.
Yes.
Now we just put a topical anesthetic and, and a little bit the first, prick, and then it goes numb. So it's relatively, fun now, honestly. And so that I feel is a change in the products. Most of them Lido containing are a big relief, and most of them are. And then the second thing is regarding the injection techniques. Now I started injecting lips, my belief is that the lateral part of the lips are relatively, danger free. The central part of the lip is danger, if at all. So I like to only enter from the sides. I like at least I practiced earlier the technique that, you have a single point, and I use a long needle, not the cannula. I've used the needle initially way back in 2004 and 5. And I would make one entry and then slide along and, kind of a typical fanning technique, changing the planes, sandwich and fanning both. This is how I would do. And I must say, I have never ever encountered, see, apart from the fact that some people would swell up more than others, but I've not encountered a hematoma per se. So, but however, later on, since the focus became more on the central lip and nobody wanted, just the volumization of lips, there was more of talking of the Cupid's bow, philtrum. So we had to go into multiple fanning. So then I reduced my needle length to smaller, the one which you get along with filler, and started injecting, right? I still don't do the Cupid's bow so much. I kind of restrict. But yes, now we do the multiple technique. Then, as you mentioned, came the bolus technique, then the Russian lips. So all these, see, like Russian lips, initially when I saw it on Instagram, I dismissed it, thinking it is again one of the marketing gimmick. But if you go to see making vertical pillars in the lip, also reduces any vascular complications. If the artery is like this is how we are going. Though of course the artery is much outer in the upper lip. So I feel, and then the bolus technique I use a lot in the lower lip, not in the upper lip, but a lot in the lower, when the lower is much thinner. So that is how the technique has evolved. Now coming to the patient's, need.
Exactly. Like, how do you change it? Like, if somebody wants if they want a particular kind of lip, they show you a picture. So do you incorporate, what you already know, or do you like to experiment with things that you've seen?
I like to experiment. I like to play along my patient. I actually put the picture or the phone in front. Okay. And we work it out together. I kind of, involve my patient in designing the lip. So, whatever the end result, of course, if it is something overboard, I tell them that my advice is that we should be avoiding, like sometimes I feel there is a lot of focus on the upper lip being heavy.
Right.
which in a way freaks me out, because then your side profile, you have a projecting upper lip.
Yes.
So I try and tone down that, try to put the focus on the lower lip. But yes, that's something I've learned in aesthetic, that the patient has a mindset.
Yeah. And what is the demographic of your patients?
See, if you ask me, I've had a lot of males and transgenders also. Not really many. I have a lot of transgenders, but not many male. But primarily, I have females of the age group between 20 to 35.
Right. Yeah.
These days, they are inspired by Instagram. For example, the Game of Thrones
Yeah.
got me a lot of Khaleesi lips.
Yeah.
Okay, so that was it. That is what, full puffy forward projecting lips.
Yeah.
But yeah, so as I said, I limit my quantity of injection. I don't. If somebody has really thin lips and they want a Khaleesi lips, I won't do it in one go, because I
Right.
understand the
Exactly.
kind of trauma and then the hand holding which I have to do. So I would
Right.
divide it in two.
Yeah. So I think it's like a journey for them, like somebody who has smaller lips, like lower cupid's bow or slightly flatter surface to work with and smaller surface to work with. They need to be mentally prepared in the beginning in the consult, that, it's going to be a journey for them. They're not going to get what they want in one session or even two sessions. I would say probably a few months, spaced 2 to 3 months apart. So here down south, actually, people are not really looking for drastic changes. They look for, very, very subtle changes, like enhancing the size a little bit or adding a bit of volume. Very few, patients I encounter who want dramatic changes, which is good, because it does bring a good difference to their face and they're happy and satisfied with it. So that's the demographic here. So what kind of filler do you enjoy injecting the most, in the sense that is it like a softer filler, or it depends on the kind of lips, or it depends on the patient, in the sense that they know, because these days patients already know what kind of filler they want. They come asking for, oh, I want Restylane Kais, or I want Define. So they do their homework and come, or you do on the basis of that, or you kind of mix it up.
So first thing is the older lips and younger lips.
Yeah.
Older lips literally suck the filler. So
Yeah.
whatever quantity I tell them, I'll end up using more. Suppose I've counseled them for 1 ml. Ultimately, I know it will be needed 1.5 ml, because sometimes they come back and say, my filler is gone, like in a week's time. And since I've injected myself, I would look at them and say, yeah. So, I like injecting younger lips. First of all, the motivation is high. The aspiration is high to get something. They have thought about it. They know, they are willing to take the downtime, which I don't see so much in elderly. Elderly usually will come when my son is getting married, and that is a danger time for me to inject. Second thing is regarding the type of fillers. Like, see, we have this Restylane Kiss, which is designed for lips. But having injected lips for literally 2 decades, I kind of am a bit unconventional that way, that I like to do Restylane Classic also in the lips. Sometimes, my fish doesn't have a kiss. And if I have a classic, so I've injected. And actually, when you ask me which is your favorite filler to be injected, for me, it's Restylane Classic, Lido. I like it. It's very soft. I can do it for any age group, and the movement is very easy. Very, it's not a lot of force. But I must say that I've injected all kind of fillers in the lips. I've injected, you name it, from Define to Volyme to all the fillers, because people who repeatedly get fillers done, the patients, they understand that what the filler is going to do. So they come and ask that, can it be a little more harder? Can it be something more which doesn't go psh? So can it be something which will define my lip? Can it be something more lasting?
Right.
Because typically lip fillers don't last long. So I've done quite a bit of fillers, but my favorite
I think for me, Restylane Kiss tops the chart, because according to the demographic of my area, it gives hydration and that subtlety, at the same time the volume and the shape the patients need. And do you come across any complicated case, like quite often, like cleft lip or really, post, traumatic cases or anything like that? And how do you approach those kind of lips?
So I have come across few traumatic scars and cleft lips.
Yeah.
I find it very difficult to correct with fillers because there's a lot of scarring in. Whenever we try to, it kind of, goes into the lesser resistance area. And I'm not happy doing fillers for post-surgical such scars.
Yeah.
I don't know your experience, Akansha, but I'm not very happy.
Yeah, I mean, it is very difficult, and it is very difficult to gauge how the filler is going to work for their lips, because it's going to work differently for them as compared to, rest of the people who have normal lips. So that is definitely a challenge. But I think a little bit of change, even 50% of what they want, if we provide them that, they are happy. And I think with Kais, I've been able to, give that kind of result. So any complications that you faced, any people talk about migration a lot these days, and how it completely distorts your lips and everything. Did you have to ever come across, crazy lip migration or distorted lips? Somebody who's been getting lip fillers done from years and, still getting it done without getting the previous one dissolved.
So in my case, because I'm a very conservative injector, though lip filler is my favorite, but I don't go crazy about the volume injected. Sometimes they say I've done 3 ml earlier, 4 ml. I don't do that. I must say that I've never injected more than 2 ml, and that also not one go. My one go is 0.5, 0.75 or 1 ml max. As I said, the older lip would be 1 ml. So I don't go crazy. So in my experience, I have had some patient having some nodules.
Okay.
That's a maximum. And, sometimes they say that when I do this, I keep biting on the, probably I've gone behind the muscle and injected on the mucosal area. So the wet, that's where I have dissolved it. Few cases I've got a hematoma where I had to abort the procedure. And usually I see that when I have done in the lower lip area, and then if I decide to go back in the end, when you give a mirror to the patient, they're like, they just put a little bit here and a little bit
I
there.
I know.
And that's when it starts. So I think abort it and then I inject, keep the filler and then inject it later.
Okay, but then I think they also need to realize, because when we start to inject, the lips start to swell up. So one side might look bigger than the other. So that also is the kind of understanding they, I think, need to have at the end of the day.
Very true. Very true. But no as such big complications. I did see one case where the filler migrated, especially the upper lip. And that was one of the cases where I used a cannula. So I figured that I somehow believe that lip is one area I don't use cannula, because I feel I don't get the accuracy. And lip filling is actually an art. You don't take a bigger brush and paint when you're doing eyes. You take a finest brush and then you draw the lashes. So I don't know. For me, it is always needles when it comes to lips.
Yeah, actually, that was my next question. What do you prefer the most? And yeah, personally as well, I feel like needle is more precise. I can give definition properly. I can, provide the volume that they need with cannula. I mean, I've never tried cannula, but I have seen people do that. But I don't understand how you get precision from that. So yeah, for sure, needle is the best for that.
I think somebody has put a question. Oh, that is for the end, is it? Yeah. Okay.
If you all want to take it now,
so let us start the presentation.
It's a very interesting question. Okay.
Yeah.
You are the master of the game. You tell me. Fair enough.
Since we are going into the presentation now, it's one question. Maybe we can just take it and then we go ahead with the presentation.
I love questions. Okay, while doing a filler, what remains best? Applying a numbing cream or injecting local anesthetic? What are the chances of downtime? So Dr. Nadeem, I suppose it's a beautiful question. Now, as I said that in these days, because the filler actually contains anesthetic, so we do not inject local anesthetic now. We just apply a numbing cream that is also for the comfort of the patient. Otherwise, for me, I ask them to take a breath. I give the first very slow one bolus, and then that area goes numb. So I don't think anything which I inject. And what are the chances of downtime? I think if it's a separate question, then the downtime will also depend on your technique, on the volume, on the filler per se. But if you're asking that after local anesthetic, what are the complications, chances of downtime? No, there aren't any. There aren't any, if that has answered the question. Akansha, you have something to add in this?
No, I mean, in my practice, I usually just use the numbing cream, and then, I mean, that's it. As I obviously start to inject, the lips start to get numb and patient starts to get slightly more comfortable. So, and there is no, anyway, there is no side effect of using a topical numbing cream, except for the fact that later they start feeling the pain a little bit, maybe more, which is normal. And that's it. I've never injected a local anesthesia, so.
Yeah, I have done a lot. When the fillers came without anesthesia, when there was no LA Lido in the fillers, we've also, honestly, I have kind of drawn it in the syringe. I used to call it my champagne fillers, because take like 0.5 cc of I usually like with the adrenaline. So take 0.5 cc of lidocaine with adrenaline, take your 1 ml and then mix them with the mixture. So the final product you get is more like a bubble filler with little particles. Yeah, we used to do that a lot. We've come from Neanderthal times, you see.
Yes, I cannot even imagine. So, okay, so should we move on to the presentation now?
Yes, so we have one more question coming, but we'll take that now at the end. Let's move on to the presentation. And as I had promised my viewers, now we'll have a presentation followed by some interesting case studies that are going to be discussed. I am going to share my screen with the presentation right away. Can you all see my screen, Dr.
Yes.
Pratim and Dr.
Yes.
Kansha?
Yes, so this is like a different range of Restylane, fillers. Obviously, this for to relax the muscles and refine to, give lifting effect or filling or, adding volume to a certain area, and refresh for hydration. Next. So yes, NASHA, we've got two technologies, NASHA and OBT. So NASHA is designed for more precision and lifting effect, and it's obviously it has higher G prime, so it's firmer than the OBT technology, which is mostly for contouring and expression. It's much softer, it's much moldable. Next. In this, again, this is an ultrasound picture of NASHA and OBT, where you can see post-injection. It's basically targeted product integration, and OBT is more like distributed product integration. Next.
I will just go to the previous slide again if Dr. Apratim would like to, add something on this slide for us in terms of the difference between NASHA technology and OBT.
Not really, because clinically it doesn't differentiate so much, as I said. But yes, as Akansha said that I find Akansha, go back to the previous slide, please.
Yeah, so the NASHA
no, previous to this.
Yeah.
So see, if you see here, the kiss, define and voline, all three are actually OBT. Which are more softer, which gel well with the tissues, whereas lift actually is more designed for precision and lifting, which kind of explains its clinical effect, because I would use lift to give a projection on the chin, or I don't do personally noses, but that is where like a lift would be. So as rightly this technology is, it defines its usage clinically. They are from firm to flexible. Yes.
Okay, Dr. Kansha, over to you.
Yes. Next, as we can see in the vertical axis, we've got firmness, and horizontal, we've got flexibility. And on top, obviously, it's Restylane lift with the highest G prime. And we've got the softest, which is Restylane Refine, Finesse. So, doctor, like what other do you use this Restylane Kais for other areas also? When you do a certain type of lip, for example, much matured lip would probably need this around the lips as well.
Yeah, so not only around the lips, marionette lines, modulus,
Yeah.
I also use, if there is a repairing filler, I use it for under eyes. I use it for teardrops as well.
Yeah.
I've always interchangeably used under eye fillers with lip fillers.
Yeah, that works perfectly even for me. Whatever is left, I end up usually injecting either around the mouth or under the eyes, and works great. And especially when we're using, half a syringe for somebody and half of it is left, it's not fair to kind of discard it. So better to use it.
True.
Yes. So this is the first case. I think this is more like an asymmetry. How would you approach this, doctor?
Now, you know what? The case one is not an easy case because the lateral injection will not be easy in her case. I would,
right.
Let's talk about case one. So is there any way we can zoom in, Shriyal? No, okay, that's okay. So see, the lips are very firm. In
Yes.
case one has a firm, lip line. I would go vertically Russian lips. I would try and reduce the length of the upper lip, go vertical. She has a very good definition of the lips as such. Also, because there is shadowing on the corners, I would also do the modulus and put a bleb in the sides. But see, Akanksha, these are your cases, so I don't know what she has in mind. For me,
I think, so for her, the only problem that she had with her lips was the asymmetry. If you see
the right side is
yes, exactly. So she was completely fine with the volume and everything, but obviously when we do filler, it's not possible that we don't give any volume to the lips. So I actually did not want any height for her lips because they are so well defined. So just define the vermilion border a little bit and added volume, and that kind of did the job.
Do you have a
and also
picture?
I put like a little more than usual, some amount of filler, in the oral commissure, so it gives a lifting effect. Because if you see, her smile is little downward, so when you inject a little bit in the corner, it kind of levels it up.
Do you have a post picture of this patient?
Yeah.
Okay.
Can you show us?
Yes, sure.
Is this the same patient?
This is the same patient.
What happened to her face? She put on weight?
No, I think it is just the angle. Like this is much closer.
Okay.
It is on the same day right after the procedure. So
that's why the right side is looking a little more swollen.
Yeah.
Okay, that's a good job. So you did not inject on the other side, is it? Or you did?
No, I did the whole lip. Upper and lower.
Okay. Yeah, beautiful.
Just define the same thing. I didn't want to do too much because then you can actually disturb the symmetry even more. So I just defined the border a little bit and the right side and added a little more volume to the right side. I mean, our right, our left, and just defined the lower lip a little bit more. That's it.
Got it.
And added volume to the lower lip as well.
Yeah, then from harsh lips, you have converted it into soft lips.
Softer lip, exactly.
Yeah, that's a nice result. Yeah.
Should I go back to the previous case?
Yeah, sure. So the second one, I think, is the one that we were referring to in the beginning.
Yes. Very thin upper lip.
Yeah, and this patient met with an accident and she lost a chunk of tissue.
Tissue there, yeah.
Yes. So for her also, obviously the other side, the bulge that's coming out, it's coming out from the mucosa. It's not a part of the lip. So yeah, and on her right, it was, so I kind of just added a little bit of volume and then, you know,
Which filler did you use here?
I actually used only and only Restylane Kais for this, actually for everybody.
Okay.
Because I think her, the side which is deficient of volume is very delicate, and it's post-trauma, it was a little distorted as well. So can't really, because it's a softer filler, so it makes sense to play around with it. Maybe much firmer filler will be a little, you know, difficult.
Her entire right side is droopy. You realize that?
100%. Yes. Yes.
Okay.
It is.
She could do.
So we've got her afters. As I'm not sure if they have it in the slide though. Do we have it?
We'll check, but what we can do is, if you all want, we'll refer to the other cases as well, and then we'll
Sure.
the before and after we can see it.
She's not the same patient. This case.
They are different. So how would, I mean, what would you volumize? Right.
I would use a kiss here, Kais or kiss. Yeah, I would use that here. The lips are very, very thin, both upper and lower. Yeah, I would do an overall lip. Of course, patients, what does she want is very important. But I see a thin upper lip, I see a long upper lip length, and you know, and it's very tapery towards the ends. I think what I would like to do here is show some reference pictures of my other patients to this patient. I think she's always had thin lips. So then I would go.
Yeah, I think she had the kind of lips which disappear when you smile, which is mostly the main concern of the people with, you know, very thin lips.
True. What did you do here?
Same what you just said, added a bit of volume to upper and lower and made it a little more symmetrical, because a lower lip is not so symmetrical in the sense that I think the lateral part is, you know, the right lateral part, her right, is a little up and the left side a little down.
And what was your technique of injection? Did you
yes, for her, I used tenting.
Sorry?
I used tenting, the, you know, vertical injections, plus for definition along the vermilion, just below the vermilion border and to the body of the lip. That's it. So the tenting was a little bit more precise in her lips because they are very, very, very thin.
Got it.
So you don't want to, you know, take your injection to above, I mean, beyond the wet and dry junction. So that's why this took a lot of time actually. Even the one in case 4. Extremely thin lips.
Very pretty patient.
Yes.
Yeah, sorry. Yeah. Loud. I'm thinking in my mind. And, yeah.
Yeah.
Can I go next?
Yeah, sure. Yes.
Is this case 5, which is post filler?
This is pre-filler.
Okay. She has good lips.
She has already, yeah, good lips. I think with her, the problem was the same, that when she smiled, her upper lip kind of disappeared because she has more, you know, volume in the lower lip and it's slightly more protruded.
Yeah.
And the upper lips like flatter as compared to the lower lip.
Yeah, she also has a nice modulus, like lifted.
Yes.
Yeah.
Case 6, she obviously the volume, the definition, the downward smile, all of that was addressed one by one. And same thing for her. I think I did a couple of vertical injections in the center, not toward, not you know, the sides because there was very small little amount of space for me to work with.
I see. But tell me, did you also inject the mentolabial folds? Because there's a lot of shadowing here, so that would give her the darkness at the angle.
Yeah, you're right. I did not. But as I started to inject and after the procedure, it was already looking a lot better. So I felt like I didn't have to.
Okay. Okay.
Yeah. I think in the afters we can see.
1 second.
Next.
Let's just stay on this picture.
Sure.
Okay.
See, Akansha, because a lot of I think youngsters and juniors are watching it, and they may watch it this webinar later also. I typically have youngsters like this, especially post lockdown, where a lot of them have sat at home and put on weight and got puffiness of the face. So, you know, this is a very good case for, I would say, where I would do my HIFU and radio frequency, you know, the definition, the whole sculpturing of the face is lost. You know, there's a whole blunting of the entire features on the face. Yeah, so a lot of hooding around the eyes. So I would kind of
Yes.
devolumize the face also. Yes, we can go ahead. Yes, Shriyal, we can go ahead.
So we already did see this one. So I'll go to the next slide.
Wow. Very nice.
This was just, yeah, same volume and definition. It did a great change for her because her face looks entirely different. Next.
Okay. Very nice. Yeah.
Same thing for her. Yeah, for her, obviously, like I said, a little bit of vertical, I mean, not little, the whole lip, I did vertical injections.
Right.
And the borders and the lip. The whole lip was treated differently.
Yeah.
Next.
She looks younger. I love the job you've done. Very nice. Next, I know whom to go to for my lip filler. My lip filler
Yes,
is
absolutely. I would love to. Okay. Well, next.
So this is immediately post, right? The left
actually,
one?
yeah. All of them are right after the injections, actually, because nobody really comes or gives their picture later, 2-3 weeks after that. So yeah, obviously on the left side, this patient, she swelled a lot. And again, a lot of vertical injections because same problem. Every time she smiled, her lips kind of went in and they looked very thin. And I think she's a model. So she wanted that, volume and the height to be there.
Yes.
That's it.
Okay. Shreyal, can I take through few of my cases, which I've done a bit differently? Would that be okay?
Definitely. In fact, I was about to ask you, well, these were Dr. Akansha's cases. If you would have some to share as well, it would be great.
Sure. Just let me know if I am visible now.
Yes, it is.
It is.
You could just go to the slideshow.
Okay. Now for the benefit of all the, how do I get this screen off from my screen? How do I get this whole strap out from the top?
Yeah, I guess it's a new feature, but I can't see it at mine. You can see it on your screen still.
Chalo, no problem. Okay, so everyone, I am really passionate about lips. My first syringe I picked up for fillers was for a lip filler. So for me, it's very dear. I've injected right from the permanent filler, Acomid, you name it. Okay, I've even put implants in the lips. I'm that passionate about lips. So I want to tell you guys one thing, that when you are injecting lips, you need to keep two things in mind, the muscle and the artery. I won't be bothered about nerves so much. If at all, when we do fillers, we don't worry about nerves. If at all you hit a nerve, at most, there'll be little numbness, tingling, or, pain or discomfort, which will go away. My main concern, and it should be your concern also, is that where you are placing, what are the vascular structures in that area? Where is the muscle around? Now, in this case, in injection of lips, we have orbicularis, oris, okay, the muscle. So you can see the muscle here clearly, okay. Now, one of the possibility is that you will inject in front of the muscle, right? Muscle
Right.
is basically mid length, mid substance of the lip. One is that you will inject it in front, means superficial injections, which most of the time we do. One is that you could go behind the muscle and inject, or you could just be intramuscular. How does one know, right? So when you're superficial, like these days, most of the injections we do are more placed superficially. It will also depend on the material which you are injecting. But let's talk about lip. Now, what happens when you're injecting? Sometimes you can see the filler, right? Right, Akansha?
Right.
Sometimes you can see the line. So even if you have threaded it, you can see
Right.
the thread. So the question
Absolutely.
is that okay? You know, again, here it will depend on what filler. If you're putting
Exactly.
Akais, or if you're putting, a little boluses which are seen that time of Wrestling Classic, it's perfectly okay, because the filler is going to behave now the way it's supposed to when it is put in the tissue. See, when you put a filler in a petri dish, it is in a petri dish. It is not inside the lip substance. Okay.
Right.
So, okay. Now the thing is, when you want a projection, like I did see in a couple of your cases that time, but as I said, since I've not personally worked on them, it was difficult for me. So when I want to give, like people who say that my lip is inverting when I smile, I try to go behind the muscle. Okay. But when it is just the aesthetics of the lip, like a volume, okay,
Right.
I stay in front. In all my Russian techniques, I stay superficial. Retrograde, I stay superficial. But when I put a bolus, I go behind. Sometimes you run a risk that the product could be felt by the patient.
Yeah.
Okay, that's the thing. I'll just show you some of. So let's say, this is what is a volumization. You take multiple, of course, like here, there are literally 2 pricks on one side. Okay, this is what I would do to. I saw one of the case, I don't recall, but anyways. So this is when somebody comes with both upper and lower lip, which are thin, I would do multiple fans. This thing I
Right.
would have done 12 years back, 14 years back with a single needle, one prick, as I said in the beginning. Now I kind of do multiple pricks because I understand that I can get a better shape and a better access to the lip, like because lip is curved. So this is something that which is traditional. Now this is something which I always did earlier, a single point injection. The Cupid's bow or not, it depends. I am now gone a little conservative on injecting the Cupid's bow. Maybe I do more of filtrums, but yes, this is how I would do otherwise. I feel that if I have to give a curve of the lip, the rounding, I don't get with this technique. So then I later on abandoned it. In the lower, I do not just make it a line here. So I kind of break it. I go one, then the parallel central, and then the
Right.
side, lower lip.
Yes.
Yeah. So
Yeah.
something like this is what you achieve. Okay. This is
Yes.
like full lips. This is when somebody says that my lips are very small. Right. Now, a lip filler patient don't always say this. Some of them have a very specific demand. Like, I want this, I want a W, I want a lock and key and stuff.
Yeah.
Right. Now, this patient, she said that don't make my lips bigger. Okay. But just take away the wrinkles. So there was no question of going around near the margin. I didn't go there. I put here, I put a central, I wish I could draw a diagram, honestly. I put a central big bolus, next to it put a smaller bolus, next to it put an even smaller bolus. So I used the bolus technique only. I entered from outside and just used the bolus technique here. Whereas upper lip, I did the fanning. But again, did not take this. I didn't go on the margin.
Okay.
Yeah, I hope all of you are listening. If you have any doubts, please put in the Q&A or chat. Where are they supposed to put? Shriyal?
Yeah. The Q&A box is
Q&A,
just
Q&A
below.
box.
Q&A. Okay. So please put your doubts on Q&A because I may go a little fast as I can see the time. Okay. Now this patient had a broad mouth. My suggestion to her was that we do not inject here and we open up the mouth. But she
Yes.
wanted the entire lip done. Then what I did is to support the droop of the angle of the mouth. I do like this normally. Okay. I just do one fan and then on top of that, I do another. So I start from here and just go on the fan. Then I go down and then make upward. So I make two overlapping 90-degree fanning to support. I make a meshwork to support with the same filler. This patient just wanted big lips. Now, this is an immediate post thing, but she wanted more focus on the line, on the lip line. This is kiss only, kiss or kiss. Now, this is again a big face, but a very tiny lips. Okay. So what, of course, she didn't come and ask me for a filler. When she came for her skin, I am the one who told her that, you know, how about this? She had a lot of acne and all, but then what happens when the primary concern you have cleared, then their focus could come to the secondary thing which you have suggested them. So also for those of you who are watching this, remember that when a patient comes to you, first time they want to get their problem solved, not yours. Okay. Another patient, very happy with the lip overall, injection really nice. Immediately. This is of course an immediate, but it settled very well. Now this patient again, I found it a bit difficult, and Akansha, I would put this case for you because how much ever I would do, I don't think I find this a very difficult case because the lateral ends, like literally lateral 1 centimeter, is impossible to evert out.
Yeah.
A difficult case. If you
but
try,
still, it's still leveled up. It's
but she kept saying that I want to, like she in fact got that Game of Thrones picture.
Oh,
that is what I want. And you know, as a lip injector, sometimes I'm very frustrated.
Yes.
That I really can't do what I want to do.
Exactly.
Yeah, I hope
there's only so much you can do with the fillers and with the existing anatomy of the lips.
Because there is so much of inverting of the lateral lips that I don't know. I somehow didn't enjoy this result of mine, and it made me very sad. This is the side profile of the same patient. Now, this patient, she was an actress. What we did is, she wasn't keen on lip filler. What she said is, my lips are very wrinkled and they look old and they are dark. And she was an actress. So, discuss with her the filler. She's like, okay. But then, you know, as I said, I always involve my patient. And when I gave her the mirror, after injecting half ml, she's like, it's okay. I like it this way. You know, we leave it. So the remaining half, now this was kiss. This was kiss or kiss. This was kiss. And what I did is the remaining, I took a cannula and I injected in the under eye. I was so happy.
But I have always realized that people come back for more because they don't realize 0.5 is actually so less. And once the swelling settles down, they are like, oh my God, I really love that swelling. I really love
the first timers, yeah, true. But the first timers who actually have not come to you for filler, they actually, like this patient stayed happy. She's like, you know, my darkness is reduced, my, you know, wrinkles are reduced. Same patient, a close up. Now this patient came with big lips, so my reaction was, ooh, you know, she's like, I want more filler. Can you put 2 ml? I said, you have good lips. No, but I want more. So I understand that she wanted. She's like, I have done it long time back. The filler is gone. So I injected 1 ml more. She wanted more. I said, let's do it in next session. So according to me, this was it, but she loved the results. This patient, we did a filler. She was going to meet her boyfriend and not boyfriend, guy who was going to see her. So right side, but she got so depressed after doing the lips. My single case of my life where I have dissolved the entire lip filler is this. She's like, doctor, I know it's not your fault, but somehow it's running on my mind that I do not want. So for those of you, I'm sure a lot of people will have that question, and I'm not sure if we'll have a time to take your questions. If you ever dissolve a filler, never judge it at that time. It would take 20 to 24 hours for the final hyaluronidase, results. Here I injected actually with a cannula all over because she just wanted the filler to go away. But, you know, normally we dissolve only when there is a lump or a little, nodule. So we just go into the substance of the nodule. Sometimes you have to go with a needle in that case because you have to prick the whole, whatever the formation, because there could be a pseudofilm, and go into the center, hold it, and then inject it. I usually do 75 units per site. Yeah, sorry. Yeah, please go ahead, Akansha.
So the second picture is her face right after the filler, right?
Yes.
Which is actually looking nice.
Very true. Oh my God, I have asked my dermat, everybody to counsel her not to do, but anyway, she wants.
It's actually harmonizing her whole face because she has a broader nose and smaller, mouth. So this enhanced lips are actually harmonizing her face. So,
and according to me, it didn't make a boob lip also, but anyway. Okay, now these are some transgender pictures, where we do laser hair removal for transgenders. And then the next, after the hair is gone, comes that feminization. So, doing a little bit of lift in the chin to just give a more pointy chin, converting a male chin into a female chin, and also doing little fillers. Here it is see, I feel this is very challenging because they already have a very defined margin. So all you can do is you can soften it up by adding into the volume. So I have, even this case is a transgender where I've put only half ml of filler. Now this case again, she wanted like there's some patients who come and say, I don't know, but I know you're good at it, so you do whatever. So anyways, this was such a case which we did. You can see it's very balanced lip now.
Yes, it
Very
is.
balanced. So again, this case who came and said, don't make my lips big. I hate big lips. Just hydrate them. So just take away the wrinkles. So I was trying to put cases here because, various, we have to hear to the patient what they want.
Exactly.
And then you will choose a product according to what they want.
I feel like what your vision is and what patient's vision is also needs to align.
True. Most of the time, in my case, it doesn't. But I have to make a compromise and I have to come down to understand from their point of view.
Yeah.
With some patients, like this patient also, no wrinkles. So usually, a lot of my patients who are Caucasian, that's what they want. She was a model from Dubai. She, of course, let me record her video also, which honestly I can't find right now, but it's on my Instagram. So if anybody wants to see, you can go to cutis.in, my Instagram page, and check that. So, she a broad face, nice sculpted face, beautiful girl, but the lips are extremely thin. So what I did is I did that thread technique. I saw it somewhere and I was very impressed. So, you just, stop the filler from going from the median. So I asked her to hold a thread here, put just 2 boluses, enter from outside, then touch the lip. And vertical one, yes, I did the fanning technique. You can see that lateral, she's got a beautiful projection now rather than, the folding in of the lip. Another case of more of lateral focus because her central lip was good.
Yes.
Again, another
and
case.
asymmetry as well.
Yeah. Now, this patient was very typical. I know, Shriyal, I am rushing on my time. See, she said that my lower lip is ending before. So first I didn't understand. Then I took a picture and saw that, her borders were really up. Her mucosa ends much up. So she said the problem is I have to always put lipstick on my skin, not on the lip. So this is what we did. We just kind of did more on the lower lip here. Now, if you see laterally, you can see that we have kind of done a linear threading along her lower lip line. And see, this is her result. And this is how she loves putting her lipstick now.
Oh, wow, this looks really nice.
Yeah. So, yeah. So, Shriyal, these are few of the cases which I thought that I would be able to talk better with the
Absolutely. Some very great
Perfect.
cases. Now I'll
take
request
up the
you to
questions
please look at the
now.
Q&A box. We have some questions in there and we can take another 10 minutes. So even to all my viewers, please key in your questions in the Q&A box. We'll just have some best picks and we'll have the doctors respond to them.
Of course, anytime. And if it is missed here, kindly get on my Insta and write to me. I will be more than happy. So the question from an anonymous attendee is that, is it possible to see filler migration? Yes, very much. Very much possible to see filler migration after 10 days. I've had a patient, that lip guy, coming right after 3-4 days. Of course, first time I send her back saying that, let it settle down, but it didn't settle down.
Okay, but what was the difference? Like, what was it? The different technique or a different product you tried?
No, no, I did a cannula.
Oh, okay, with cannula.
So when she said that when she did this,
yeah, she could feel it.
The lines could be seen. The lines could be seen. Any your experience similar, Akansha?
I have actually never used cannula. I only use cannula for jawline, tear trough filler.
Okay.
That is it actually.
Any migration?
No, never.
Okay.
I never actually, luckily, I never had to dissolve any filler that I have done previously, but I did I mean, I have dissolved somebody else's filler and I have redone it.
Okay.
But no, I never had to dissolve. It's probably yet to come.
Okay, I think what Anushruti Das is saying, I think we answered it. Would you prefer a needle or cannula for lip injections? If needle, then probably what depth, and if cannula, then what technique? Okay, so I'll just repeat it for your sake, Anushruti. I always prefer a needle when it comes to lip, and I like to place my products superficially. So, if you can see the needle when you are injecting under the lip, it's perfectly okay. You can even tint it out, like lift it off a bit, get away from the blood vessel. That's also okay. Uh, if needle, then what depth? So as I said, superficial most of the time. And if cannula, then what technique? So if cannula, then the technique will be, see, first of all, you have to enter from the modulus area. You will make a little prick there, and then you will advance. You can see with, you will obviously use a long cannula. With one single prick, you will be able to do the entire lip. So I believe linear threading technique only, or at most you can fan a bit, but I'm not a big fan of cannula for lips. What do you say, Akansha?
Yeah, for sure. I mean, like I said, I think I get more precision. I want to know exactly where I'm going to inject. And for me, I really take my time to assess the patient before I start injecting, just to, understand the shape of the lip, just to understand where the dry wet border is, and, just to kind of make a model in my head that, okay, this is how I want it to look like, but it might not take the same route. Sometimes fillers also, look differently when you start to inject. So in that case, the best thing to do is very slow injections and very, very precise, which I think I get from the needle.
Right. Can the, I think the same person question that, can the migration be because of patient lip biting? I doubt it, honestly, because no, I don't think so. That because of lip biting, no, I don't think it can happen. Because you have to really place it on the, wet mucosa for it to be accessible to patient to bite. So I don't think so. Then
there's another question, but I don't know who sent it. What are the common difficulties young injectors face while injecting lips? How to get over
where
them?
is that question? I can't see.
It is there in the box.
Acha, I don't know. What is the question? Sorry, I can't read it, so you can read it out. Okay, let's go by order only. Okay. From the top, what gauge needle do you prefer for? No, sorry. What gauge needle do you prefer injecting the lips? What also what's your take in transferring the product to BD syringes and injecting? So first, to answer the first question, I prefer 27 gauge. I know most of the lip filler boxes will have 29 gauge, but I don't like to put pressure that time into the lip and lose my precision. So I actually prefer 27. Even if 29 is available, I move to 27. I like a little bigger needle because I'm more, my plunger is more in my control. Also, what's your take on transferring the product to BD? See, if you can transfer it in a sterile way, nothing, no problem at all. I don't do it per se, but I used to do it earlier. And then I gave up because it's too much of hassle and I don't want to run a risk of any infection. But yeah, it will be much better injecting with a 30-31 gauge needle. So if you can do it, the product should also come out fluently, means fluently. Sometimes in a BD syringe, you will have a problem in pushing the product, though it's a narrow syringe. So, but if you can do it, yeah, it's fine. Anything which you have to add, Kansha?
Not really. No, this is perfect. Even I'm very, very comfortable with the 27 gauge.
Yeah.
And it kind of, I'm able to push it, smoothly.
But if you want to get a better control, you can always try doing that. There is no harm. I've seen a lot of my international injector friends, they routinely do this. How much do you charge for 1 ml of filler? See, whatever you get the filler for, you add 30, 40, 50% and charge. I think it will vary city to city, person to person.
Yeah.
right? So
I think even in the same country, from city to city, it kind of differs.
yeah.
Here down south, it's slightly, I think, cheaper than where you are in Bombay.
But talking of this, I remember once a patient came to me and she wanted to do Restylane a long time back, and I told her the charges. She's like, "But I pay literally the same in America also. Then why should I do it in India?" You know what I answered? I said, "What makes you think that I'm using some inferior product in India?"
Yeah, I
You
know.
know. Anyways, patience. How many days can we store up the filler? If see, honestly, I have a separate fridge for fillers and botulinum, and I save it up to 4 weeks. Okay, after that I use it more for training purposes or scar correction. So I suppose 4 weeks. What about you, Kansha? How long do you?
Yeah, yeah, 2 to 3 weeks, I would say.
Okay.
Same.
Okay, please enlighten regarding Hylas injection. So Hylas comes as 1500 international units by the name Hylas. I buy Hynas or Hylas, you can pick up any. It is 60 rupees ki vial. Okay. Now what you have to do is imagine you have 1500 international units. I would like to inject 75 units at one site. Okay. Now I don't like to put Lido. No, because the swelling later on is a lot. I like to just dilute it in saline. If you want, I can just get on my Insta and I'll give you the formula. There's no such formula. You first add, because you can add only 1 cc saline into it. So you first add 1 cc, then you draw part of it, then you draw saline separately in the syringe and see that you are coming up with 75 units at one spot. So usually the under eye, if there is something which has gone wrong and the patient it's visible, then I put 150 units, and on the lip nodules I put 75 units, and the remaining, obviously you won't use a whole vial, I'll throw it away.
Yeah, exactly. So
Yeah.
yeah, same 150 units is what I use as well. So
Yeah.
for older patients more than 60 to 65 years who have wrinkles in upper lip, do the fillers make them look younger? Absolutely.
You could also do a resurfacing with the carbon dioxide
Yeah.
and do the filler also. But if they don't want anything like that, of course, fillers will make them look younger. But you'll have to counsel them about the downtime, about the swelling. And, I have done a lot of such patients and they've been happy, very happy. Okay, Vidushi, you can connect to me on my Instagram
I'm a
page.
fan. So nice, so sweet.
Please connect on my Instagram, cuties.in. I have a personal page, Dr. Apratim Goel, but you will find only dance videos on my personal page because I have taken on a hobby to lose weight these days, which is Bollywood dancing. So please connect on any of this, either Dr. Apratim Goel or cuties.in. Okay. Ma'am, is migration possible even if given in the right plane? Should we try molding the product? In my experience, if a migration happens, you have to dissolve the product.
Yeah, you can't really do much about it. You can't really
Mold
push
it
back
because
in the
I believe the filler has integrated into the tissues. So why are you so scared? If there is a migration, just take 75 or 150 units of Hylas in a BD syringe and just hold wherever the thing is, lip or under eye. I suppose you must be talking about one of those, and inject into that. Keep your finger, keep it pressed. It will blanch, and then you remove it, and that's it. And then massage the product because it has to break the adhesions. And so basically it doesn't disappear. A lot of time patients say that I did Hylas and it disappeared. So I tell them it's not disappeared, it has just broken down.
Yeah.
No, don't tell a patient you are dissolving, because
Yeah.
then it becomes like my money is going down the drain.
Yeah.
So it is not like you are disintegrating it. It will be there only, but it will just break into smaller particles. What's your take on aspiration every day?
Dr. Neha Kurana.
Dr. Neha, depends, which area I am. Sometimes I do. Most
I
of the
think
time
for
I
lips, it's just more traumatic to aspirate every time you inject. It's traumatic to the lips than, I think you just need to know the anatomy properly.
I'll tell you, Neha, one more thing. When you're injecting, if God forsaken you are in a vessel, you will have a lot of resistance in injecting.
Yes.
So once you keep injecting, you will come to know that you are in a vessel. Also, let me tell you another thing. The arteries run like this, right? So if you are doing vertical injections or slant, there is less chance that you are intravascular. At most, you will rupture an artery and go through it. Artery, no, a small vessel. See, here it is superior labial artery, which is usually in the substance outside. Only in the center, it comes here, it gives off a columella branch and it comes here. Whereas the lower lip, the outside, there are no artery. It's later on that it enters. So I am not really worried in the lip, honestly, about it. But yeah, if you feel that there's a lot of resistance, then you slow down or you withdraw. Anything to add, Akansha?
No, it's perfectly fine.
Okay. So being a newbie, I think this is very over. Being a newbie, I have a natural fear of fillers. What will say? It's okay to be scared of fillers, but and you know everybody will tell you know the anatomy, but let me tell you, you can't trust the anatomy, because anatomy is something which is so baffling. I have had a transverse facial artery run right here, which I thought, oh, safe, talk and gush of blood on my face. So yes, I agree that there is a fear. Okay, what you need to do is you need to pick up one indication. Don't pick up nasolabial. For me, that is an advanced indication. You actually should pick up lip. Take somebody, you know, do it under the guidance of someone, or get your patient and filler and come to Bombay. I'll guide you. Okay, so do it. Just somebody needs to, first time when you hold the syringe, give you a little confidence. Okay, there's nothing to be very scared of. You guys do intralesional triamcinolone and 5-FU and things like that. They are also injections. So I don't think you have to be scared of. And be on Instagram on hashtag beautiful lips. So you will get so inspired looking. Akansha, have you done your lips?
No. I told you I was born with really big lips, and now I told you I used to be so insecure about it, and now it's in trend. So
I wanted my audience to know. I knew it.
Oh. Yes, no, I haven't, but maybe at some point I will. But I think if I do,
I'll inject your lips. I would love.
Look like alien.
Yeah, no, you're beautiful lip, but I have got injected. I have actually got kiss in my lips only. Okay. What is the approach to M-shaped lips? Neha, I don't know what is M-shaped lip, but I suppose, I don't know. What is M-shaped lip?
So M-shaped lip is prominent Cupid's bow. And so what I like to do is I do diagonal. I don't do vertical injections from the vermilion border. I do go kind of diagonal and vertical both. So it gives you a nice M shape. Along with that, you need to
filter.
Yeah, exactly, filter. So that will give you a perfect M-shaped lip. But then it again depends on patient to patient, because if they have a really low or flat Cupid's bow already, or they have absolutely no definition, then it is not possible to give M shape in first or second session, or probably not even in third session. So first,
I have something to add here, that when you do this, all the M shapes and V shapes, whatever, I don't think you should be using a kiss there. You should be using a define.
It doesn't hold. Yes.
Exactly. How will it hold? It won't hold. So you have to have a lift or a kiss or a define. I have done define for lips and I love it. Okay, just to hurry up. How do you handle the droop at the corners of the mouth? So I make a two mesh. So one fan like this, and another fan like this. One along the extension of the marionette line, one perpendicular to it, and it will just kind of suck up here and kind of hold it up there. How much dilution do you use, Hylis? So I actually first put 1 cc. I think we discussed.
We discussed this already.
Shreya,
and I think we're done.
How many units of Hylis to dissolve a lump? If needed, the entire lip filler. 150. See, whether if you want to remove the filler, it's different. You can even use up to 600 units. But if you're just doing the a nodule, then 75 is enough.
Yeah.
New injectors, any specific tips? No, get yourself injected once. It's amazing. I think in fillers, the bestest is lip fillers. Honestly, guys, if you're not injecting, you are missing something. How long does it last? 6 to 8 months, but sometimes people who smoke and all, it can go faster also. But generally, I tell them 6 to 8 months if I put a lip filler. If I put
Yeah.
some other thing, then depending on the longevity.
Surprisingly, I have one patient, and out of all my patients, actually, that is like one in everybody, that it's lasted more than 1.5 years.
So I want to talk
Nice.
about it a bit. If you get an ultrasound done, I have seen under eye fillers last for 3 to 4 years, even
Yes.
longer. So actually fillers are not the way company would tell you. So in fact, all of you who are seeing this, please start reporting it. Let's put our observations together. Maybe give it to Galderma or give it to whoever your fillers are from. Because I have seen under eye filler lasting for like, I don't know, donkey years.
Yeah.
And so, yeah, I think fillers, depending on the plane of injection, depending on the metabolism, they can last much longer, but at least they last 6 months for sure. I think the questions are done,
I
Shreya.
think we're done.
Yes, the questions are done, and that's when my camera gets on. So thank you so much. I think it's been a completely intriguing, insightful, informative, all the words that I can gather with I right now, but the session has been totally informative for our audiences. Thank you, Dr. Apratim, and thank you, Dr. Akansha as well. And this brings us to the end of today's webinar on lip fillers. Like
I
I
don't want it to end.
well, I
Same.
personally would have
We
not
can talk
wanted to
about
end
this for
as
another
well.
hour.
It is so nice. It's not that boring conference where, you know, somebody goes on talking from the slide.
Well, and I could just see the passion you both hold for the topic actually, because especially when you all were discussing your cases and answering all the Q&As, and I would have loved to entertain the audience to send in more questions, but unfortunately we have a stopgap.
Can I also make a personal, what to say, announcement here? I'm looking for doctors to work at my clinic. So please, if anybody is interested, please mail me your CV. Thank you so much.
Nice. Okay, so having said that, yes, we are at the end of today's webinar on lip fillers. The webinar was organized by Aesthetic Medicine India and powered by Galderma. I would once again like to thank Dr. Apratim and Dr. Akansha for being part of this webinar and sharing such great insights. It was indeed a great pleasure hearing from you. Our partner Galderma, thank you for all the support. I would also like to thank the viewers for your support and being so active in the Q&A box with us. Only helped our doctors give you more information. Kudos to our dedicated team for putting this event together. And as we come to the end of this evening, here's looking forward to a positive, safe time ahead for all of us. And like I mentioned, this is just the second episode. There's a lot more that we're going to come with. We're going to be connecting with you on email. My team would be very actively doing that. Else, follow us on our social media pages on Instagram. Like I said, all you need to do is Aesthetic Medicine India. Do not forget to put India, because we have a UK team page as well. So that's where you get us, and you will have an update on everything that we're coming up with. So thank you once again, and have a lovely evening, all of you. Stay safe.
Thank you.
Thank you.
Thank you.
Bye. Bye.